Thank you so much, Sue, for agreeing to talk with me today. For anyone watching this who doesn't know who I am, my name is Shawna. I'm a volunteer with the Enneagram Prison Project. I coordinate our social media. And today I asked Sue to join me to talk a little bit about how the pandemic and COVID-19 is affecting the students that we work with inside jails and prisons, and just to shed some perspective on that. So Sue, if you would, why don't you introduce yourself and tell everyone who you are and what your role is with EPP.
Okay, well, first, Shawna, thank you for inviting me. My name is Sue, and I work with the Enneagram Prison Project. I'm the Ambassador Liaison, and I am the facilitator for our Reconnecting group, which is a weekly meeting we hold for people that took our class when they were incarcerated, and for continuing self-awareness work when they get out and get home, so we can continue to support them. And I learned the Enneagram through Enneagram Prison Project when I was incarcerated. I spent some time in both state prison and county jail.
Thank you, Sue. So right off the top, I am curious. You know, everyone in this country right now is being affected in some way by this pandemic. But I feel like, people who are incarcerated tend to be a bit forgotten in our population. And so I'm curious, what are your thoughts on how this pandemic and coronavirus are affecting the large number of people in this country who are inside a jail or a prison right now?
Thank you for asking that. I think that most people know that we hear about how the incarceration is so overpopulated. There just isn't space inside the jails and prisons to do the social distancing to any degree where it would help the people there, the inmates or the staff. Really, it's almost impossible. My experience was in the prison system was eight people in a room that was like 40 foot by 40 foot. So that would be like 4 double bunk beds sharing 1 bathroom, 1 shower, and 2 sinks. So I know that right now in that particular prison that they're having to keep people locked down like 23 hours a day. I think they're starting to do some kind of rotation where they could get out an hour a day, a couple of times a week. And so in that type of environment, it's like you're going to be with the immediate population around you. And they don't do room service. So, people have to go out to the chow line and get in the room for chow. And I was told that they are, these are 4 tables that hold 4 people. So they've changed that to 2 people. And those 2 people are sitting across from each other a couple of feet away. So I just think that it's not a situation where the state has the manpower to like start pitching tents everywhere and to get social distancing. From what I understand, there's not the supplies that are needed to do the proper cleaning and to continue the cleaning. And so it just puts the situation in a very vulnerable environment for everybody. Yeah, so it's just not a very good situation for sure.
Thank you for sharing that. And as you're talking, I'm thinking about, so you've talked about kind of the physical ramifications, right? The lack of social distancing and, lack of appropriate staff, right? To even make any significant change in that. But what about the, kind of the mental impacts? I mean, I know like everywhere else, there's no more visitors, right? There's no outside visitors. The programs like Enneagram Prison Project that would be bringing people from the outside in to provide education and training and programming to people on the inside, all of that has stopped. And what are your thoughts on the effect that might have?
Well, I think it's an added effect to what people are already going through. I mean, I could take eight people off the street that have never been in trouble, that have somewhat of a normal life. And if I lock them down in a 40-foot by 40-foot room 23 hours a day, it's just human nature. There's going to be arguments, fights, disagreements, a henpecking sort of system where, you know, the stronger or more dominant. When you're in a situation like they are right now, the classrooms, the programs, they are what give people, bring some hope to them, to change, to interact with people from the outside. I remember when I was inside, just being able to have a teacher come or a preacher, just that human connection to continue to know that there's some other kind of life to improve yourself so that you can better connect when you get out, is the hope. And you know, when you take the hope away, whether it's the virus or whatever, what ends up happening is the anxiety level inside is already so high that this just shoots it right over the top, and people become more distant or more aggressive or more afraid, more angry. And then what ends up happening is it's a domino effect. It's like when the fights start, there isn't enough staff. So the staff cannot, you know, if you have two COs taking care of a pod with, say, 200 people, what are what are they going to do, right? It's like, so the only alternative is lockdown. And so when people are locked down and they don't have any kind of an outlet like outside or the programs, it just intensifies everything for everybody.
Yeah. And kind of sticking with this idea of programs and the importance of programs like Enneagram Prison Project and many, many others. You know, I had a conversation with a friend of mine who didn't have any connection with the justice system, didn't really have much awareness about what programs are available. And he asked me, you know, because I was talking about how, you know, people aren't being able to go inside to program and to provide these services. And he asked me, you know, well, how important is that really? You know, do those things even work, right? Like, do these programs make a difference? So what are your thoughts on that?
Yeah. So it's like anything, I think, in life. When people find their way to make a decision to change, they need a helping hand. And when people are inside, and a lot of them have, you know, let's look at the history. A lot of them have had really, really tough upbringings, really tough starts. So when someone wants to change, one of their the conduit to change is the programs and the self-improvement. There are credits that people get. They can get credits now for taking programs to reduce their time. This is huge. There's education that people could get. They learn trades, self-awareness work, mental health. The list goes on and on. I think, you know, a couple of the larger prisons, I think like San Quentin, they had over 100 programs. So if you take away 100 programs, I mean, what are people left with? It's not everybody gets money from people on the outside. Not everybody gets boxes, or not everybody gets boxes or something you could send people. Not everybody gets money for commissary. So a lot of people are there with just the very basic, what they can get from the state while they're there. So that doesn't mean the state's going to give you coloring books or pens to write with and stationery. There's a very minimal amount of things that are free. It's very limited. So again, everything that people have in there becomes like an object of power. And the people that have that can make their way a little bit better, and it's just a matter of survival. So taking
Yeah.
away programs really limits how people can change and grow.
Yeah. You know, it's striking me as you speak, and I kind of want to close with this. We're all, like I said at the top of our discussion, like we're all being impacted by this pandemic. And I know for me personally, when just listening to you talk, and when I think about, you know, all the men and women in this country who are incarcerated at this moment, and all the correctional officers and prison employees and administrators who are going to work in that environment, you know, where, you know, programs are being shut down by necessity, right, to try and do what can be done to protect people. It feels very overwhelming, and it feels, you were talking about hope earlier, it feels a bit hopeless, right? So what can people do? What can people like me, like my friends, my family, people that are on the outside, what can we do during this time to help kind of lift up people who are incarcerated? Is there anything that we can do?
That's another good question.
Mm.
There's always there's always social justice change that you can get involved in. There's some very active groups that are working to change things for the future. And, you know, as I talk about how bad it is inside, I also want to reflect that it's not an easy answer, because
Right.
opening up the doors and turning loose people that have nowhere to go and no money and nowhere to live creates just another problem, and
Sure.
another situation where how are they going to survive? So the problem is overcrowded. The problem is lack of staff. The staffing is very low. The prisons are very old, a lot of outdated things. Um, the the system needs to be renovated completely. And so that's a huge project, and it's not going to happen overnight. It's not going to happen just because of the virus. But I think that if you have a way to reach out, there's some correspondence programs. You can actually contact the CDC and see about writing people, supporting the programs that we are doing. Like I know that with our program, we're trying to get it on video. There are some other groups that are working on video classes. And I think that there's a few groups that are supporting of children who have parents that are incarcerated. So there's a lot of social programs that people can get involved in to help. And it's a long-term problem and a long-term fix.
Yeah.
And it's just really a sad, dangerous situation right now for the people that are inside those locked doors.
Thank you so much, Sue, for sharing your perspectives and your thoughts, and for talking with me today. I think it's a really important aspect of what's happening right now in this, you know, point in our history that we're all experiencing, and that we shouldn't forget about, right? We shouldn't forget about the people among us, the people, our family members, our friends, our loved ones, our community members who are on the inside, who are incarcerated right now. They should not be forgotten. So thank you so much for shedding some light and adding your perspective to what's going on. I really appreciate it. I'm very grateful.
Oh, Shawna, thank you so much for having me. And let's just all try and be as safe as we can right now. So thank you.
Yes. Thank you. Take good care, Sue.
Bye-bye.